In America, there is without a doubt flaws in our healthcare system and insurance coverage. I think we have all heard a situation about somebody having to go to the emergency room and paying out of pocket for that visit because they didn't have health insurance and they needed to receive healthcare. Healthcare is expensive and insurance may or may not cover all visits. In 2022, 7.9% of Americans were uninsured for an entire calendar year, per census.gov. Of those who were insured, 65.6% had private insurance and 36.1% had public insurance. When considering the percent of Americans with insurance, know that this statistic includes all who were covered under any portion of the entire calendar year. The Center for Medicaid and Medicare Services, I'll also refer to them as the CMS, reported that for patients covered under Medicaid or Medicare, healthcare costs rose by 15.5% combined in 2022. Private insurance spending grew by 5.6%, and out-of-pocket costs grew by 6.6%. The CMS projects that for any of these coverages, costs will rise by 7.5% overall. Because some may not have options of health insurance through their employer or have other circumstances that prevent them from having coverage, they may have to pay out of pocket when receiving health care. This means that 100% of the costs are paid by the patient. At times, health care costs may be discounted, but it's not guaranteed if you're paying out of pocket. As census.gov showed, 65.6% of Americans had private insurance. Private insurance can be provided through an employer or also sought out by the individual needing health care. This coverage does have monthly payments, deductibles, and a percentage of care that insurance will cover. So for example, an 80-20 model would have insurance covering 80% of the cost, and then the remaining 20% would be the patient's responsibility. Employee-sponsored group insurance provides coverage to a group of employees and their dependents. Healthinsurance.org mentions that the group insurance is more often provided to large companies with 200 or more employees. One issue with this coverage is that the premiums change often and the deductibles and out-of-pocket costs rise often as well. Public insurance, otherwise known as government-sponsored insurance, is insurance provided by the state. Medicaid and Medicare are common examples. This does also include insurance for veterans through the Veteran Affairs, the VA. Census.gov explained that Medicaid is coverage for low-income households and also offers CHIPS, which is Children's Health Insurance Program, as a branch of Medicaid. And the Medicare's for those over the age of 65 or with specific long-term disabilities that meet the requirements that are set by Medicare guidelines. Thank you.